Welcome to the Smart Tips for Stroke Care series. This topic of Smart Tips covers positioning in bed after stroke. Smart Tips for Stroke Care is a guide that explores 15 different topics related to stroke. It highlights common changes due to stroke and strategies for managing these changes. You can find the complete guide on the Core Health Ontario website and the educational videos on the Central East Stroke Network website. A stroke can impact a person's ability to position themselves in bed due to weakness or hemiplegia, changes in sensation and body awareness along with altered muscle tone. Being mindful to use careful positioning techniques can improve joint alignment, increase awareness of the affected side, reduce fatigue and improve comfort and safety. What you should know about positioning in bed after a stroke. A stroke can cause a lack of sensation on one side of the body, so it is important to monitor the person's skin for redness or other signs of skin breakdown. After a stroke, a person's sense of where their body is in space may be decreased, which can make positioning difficult. Development of shoulder and/or arm pain is common after a stroke. The affected arm should always be well supported to prevent pain and injury. For more information on the hemiplegic arm and hand, see Smart Tips for Stroke Care Guide. Proper positioning using recommended equipment such as pillows, rolled towels, or equipment specific to the needs of the person can increase comfort and safety. A comfortable position can help ensure proper rest and assist with fatigue throughout the day. Taking opportunities to position the person on their affected side for a period of time as part of the regular position changing schedule has benefits such as increasing circulation, sensation, and awareness. Remember to always follow the care plan at your facility. This section will provide tips on how to position a person in bed after stroke. Explain to the person what you are doing and encourage them to participate. Ensure you have everything you need to position the person safely, such as extra help or devices and equipment such as a slider sheet, etc. Always ensure good body mechanics to avoid injury. Ensure to consider safety throughout. Take your time and position the person by moving slowly and gently, and be mindful of the person's arm as you move. Avoid pulling on the person's affected shoulder or arm, as this can cause irreversible injury. Ensure the head of bed is at the recommended height, especially if the person has difficulty swallowing. Make sure all necessary items are within the person's view and reach, such as a call bell on the unaffected side. Check that the person is comfortable before you leave the room. Consider whether you would be comfortable in this position. Check on the person regularly and offer position changes frequently, and use bed rails according to facility policy. When positioning the person on their back, ensure the head and shoulders are centered in the bed. The affected arm should be supported and elevated on a pillow and positioned slightly away from the body with the elbow extended and the elbow crease facing slightly upward. Place the palm down with fingers straight. Place a folded towel or something similar beside the affected thigh to prevent the leg from rolling outwards. Ensure to use recommended equipment to reduce pressure under heel, especially if the person is unable to move their leg. When positioning a person on their affected side, ensure the person is not lying directly on top of their affected shoulder. Draw the shoulder blade slightly forward and have the elbow extended and hand supported with the palm up and fingers straight. Support the unaffected arm forward on a pillow. Place a pillow lengthwise behind their back so the person does not roll backwards. Lastly, position the person with both legs bent and with a pillow in between the knees and ankles. Finally, when positioning the person on their unaffected side, support the affected arm forward on 2 pillows. Elevate the hand as needed with the fingers spread. Place a pillow lengthwise behind their back so the person does not roll backwards. Position the person with both legs bent at the hips and knees, a pillow in between knees and ankles. It is important to note that when a person is lying on their unaffected side, some people feel trapped if they cannot move their affected side. Ensure to check their comfort before leaving and check back frequently. Always seek extra support when required. All team members have a role to play in positioning a person with stroke. Occupational therapists and physiotherapists are skilled in positioning. It may be helpful to involve them in the person's care. For more information on Smart Tips, including other topics related to stroke, visit the Core Health Ontario website.